Hello guys, this is Dr. Palani Pramanika. I'm so happy that you guys responded positively to my reaction video on Onion movie. There were so many positive comments. Thank you so much because I absolutely love this format. There are two advantages of this format. One is we can actually see our favorite movie. The second is we can learn from it. So in this episode, we have decided to review Vasool Raja MBBS, which is Munna Bhai MBBS in North India. Let's see how medically accurate it is, and also we can learn from whatever we can from the medical angle discussed in the movie. Let's dive deep into it. We're going into the operation theatre. First of all, you cannot just walk into the operation theatre without any gowns. It is absolutely sterilized. Most common complication of an operation is infection. So you should actually see a surgeon how they dress up before going into an operation theatre. They will not even touch anything. Actually, the nursing team may actually give the gloves to the surgeon, so the surgeons may not even touch the glove and then place it, because remember, we are all surrounded by bacteria.
என்ன டாக்டர் டிக்கெட் வாங்கிட்டு உள்ள விட்டீங்களா?
எல்லாரும் மகமூடி கொள்ளகார மாதிரி இருக்காங்க. இதுல யார் டீன்? What is happening here?
See, this position where you have your two legs wide open is called lithotomy position. Okay, this is where we actually deal with hemorrhoidal surgeries or any colorectal surgeries, where we'll be able to see the rectum and also the problem associated with it very clearly.
என்னப்பா வியாபாரம் எப்படி நடக்குதுப்பா? யார் இவங்க? பார்க்கல தேவையே இல்லாம சிரிக்காங்க. என்ன வேணும் உங்களுக்கு?
மனம் நிறைய சேர்ந்துருச்சுல, மரம் கழட்டு வச்சுப்பா.
So people think that they become psychotic to have a group laughter therapy. Actually, there is some evidence to it, where when you laugh, you decrease your cortisol levels, you get some dopamine and serotonin, which will actually help you relax, and that is why stand-up comedy, all the comedy movies are very popular, because you lower your cortisol, you feel very happy. But as a group laughter therapy, the evidence is a little bit minimal that you can supplement the overall treatment process, but this cannot just be the sole treatment. In my hospital, we don't have any kind of group laughter therapy sessions. I'm seeing a lot of laughter yoga sessions that is happening. If you practice one, let me know in the comment section whether that has benefited you. In general, please laugh.
Hey doctor.
இவர் டே டாக்டர், அவர் நைட் டாக்டர், டியூட்டி முடிஞ்சு போறாரு. போட்டாங்க டே டாக்டர்.
Day doctor, night doctor. So we always have a night duty doctor, right? Sometimes actually doctors actually love to do night duties. I'm not even kidding, because they don't want to deal with the commotion during the day. I have a friend who always wants to just do night duty from 7 p.m. to 7 a.m. so he doesn't see the day at all, because during the day there'll be a lot of coordination, lot of commotion, and he says at night he can take care of the patients completely, because most of them are sleeping.
இது வரப்போற அண்ணி புரியுமா? அதனால தான் வரப்போற அண்ணி ஒரு டாக்டரா இருந்தா அண்ணனோட கஷ்டத்தை புரிஞ்சுக்குவாங்க. கரெக்ட்.
See, this is a very common problem. If you ask the Gen Z, they don't want to date a doctor because doctor is always busy 24/7. They are committed to their service, and that's why always a doctor guy will marry a doctor girl, and a doctor girl will marry a doctor husband, because they'll be able to understand the problems behind it. But my suggestion to all you people is that please try to find a non-doctor person so that they can actually enjoy life. I was very confident that I don't want a doctor wife, because both of them will be working all the time and there will not be any angle of enjoyment at all. That is what I thought. So that's why when I saw Priya was a software engineer, I said good, beautiful, let's get this done. But there is also an advantage if your wife is also with the same profession, because they'll be able to understand the medical topics to it. My whole goal is, when I'm in the hospital, I'll be talking medicine. When I come back from the hospital to home, I will not talk medicine. That split between work home is very, very important.
ஏய் யாரு குழந்தை பிறந்தது? நீங்க டாக்டர் தான பண்ணீங்க. யாருக்குமே கல்யாணம்
This happens all the time, where we are very, very happy when we enter our first day into MBBS, because we think that we have achieved the best profession ever. But the beauty here is that usually what happens is, in our Indian community, we always celebrate by giving sweets. I had a patient, the patient had diabetes. He got diabetes because of eating lots of ultra processed food. He had heart attack. We saved the patient, we put a stent in, and at the time of discharge, the whole family gave like a huge box of laddu and then say, thank you doctor for saving my family.
Hello, yes, doctor தான் பேசுறேன், டாக்டர் MBBS.
See, we always do that on my first year of MBBS. Whenever somebody calls me, I always say, Dr. Palaniappan. What is your name? Dr. Palaniappan. That will not happen with an engineer person. Have you ever seen a person who is an engineer asking, what is your name? And the reply is, Engineer Karthik? That will never happen. You know why we say that? Because only we have to keep on emphasizing that we are doctors, right?
எக்ஸாமினேஷன் எழுத போறதுக்கு முன்னாடி தயிர்ல சர்க்கரையை கலந்து சாப்பிட்டா எக்ஸாமினேஷன் நல்லா எழுதலாம்னு எங்க அம்மா சொல்லுவாங்க. சாப்பிடுங்க.
They're saying curd rice and sugar before any exam will actually make it better. I don't know whether it is true. Only thing I can think of is curd rice will give you some good gut bacteria in the gut because of the fermentation process, and sugar may give you that extra carbs, maybe a little bit of energy before the exam, but I don't see a scientific evidence behind this.
ஆபரேஷன் பண்ணினுக்கிறீங்க.
பைல்ஸ். மறக்காம கையை கழுவிடுங்க.
ஆஹா அண்ணன் அப்படியே யாரையும் தொடாம வாங்க.
சாரிடா, நான் உங்களை எல்லாம் சந்தேகப்பட்ட. பரவாயில்ல.
See, piles problem is a very common problem. You know, we call it as hemorrhoids. Just remember, everybody has hemorrhoids. Then what is the problem? Only when the hemorrhoids are dilated and very progressively increasing in size because of chronic constipation. People do surgeries, people do all kinds of interventions. The only most important effective treatment for piles or hemorrhoids is making sure that you do not strain at the time of bowel movement. So increasing your fiber intake, increasing your water intake, and also taking medications to improve your colonic motility will definitely help. I have so many patients who have gotten pile surgery and still after that they will have the hemorrhoids come back again because the underlying treatment option is not focused on the actual bowel movement and only on the hemorrhoids. So remember, if you have any patient or any friend or any relative with problems of piles or hemorrhoids, the most important treatment is increasing the colonic motility, making sure that they don't strain at the time of bowel movement.
அதெல்லாம் வேற சர்வீஸ். நான் சொல்றது தமிழ்ல சேவை. காந்தி எல்லாம் நாட்டுக்கு செஞ்சார் பாரு, அது.
நானா?
ஆமா, பின்ன இதெல்லாம் பாராட்டுறதுக்கு பெரிய மனுஷங்களுக்கு டைம் கிடைக்காது. நம்ம தான் டைம் கிடைக்கும் போது அட்ஜஸ்ட் பண்ணி அப்பப்போ பாராட்டி.
Very important point, right? Very important. See, he hugged him, right? So, you know, he feels much better. There is something called hug therapy actually in the US. I still remember in my first year of college in Boston, there used to be like a hug clinic where you can come and hug people. The concept behind that is that when you hug somebody, oxytocin level increases in the body, which is a hormone that lowers your stress level, that actually helps you relax a lot. This is the exact same hormone that is being secreted when a mom and a baby is being bonded. I strongly believe that hug therapy should be even more widely practiced. It should not be just like treatment, medication, surgery, operations. It needs to be a little bit more compassionate, more empathetic. All these small changes, I strongly believe that patient's recovery will be much faster. And there are other problems as well. It should be culturally okay, so you need to be careful about it.
இது ரொம்ப சுவாரஸ்யமான கேஸ். இந்த மாதிரி கேஸ் மெடிக்கல் ஹிஸ்டரியில ஒரு ரேர் ஃபினாமினா.
See, usually we don't refer patients as case, so that is number one, it's wrong. Number two, this is the setting usually we get trained. You know, in medical college, there will be a patient, and surrounding the patient, all the medical students will be sitting, and the doctor will be actually teaching us in terms of what we can learn from the patient. We usually don't refer it as a case.
12 வருஷமா இது இப்படியே தான் இருக்கு.
So this patient's diagnosis is called vegetative state. Vegetative state means when there is a decreased blood supply to your brain. It could be a stroke, it could be a traumatic brain injury because of a road traffic accident, or some kind of brain injury to a point that the brain is not functioning as much as it did. It is functioning very minimally. For example, it can make sure that the lungs breathe on its own, but it don't have any other activity like, you know, talking, walking, or something like that. We call this as vegetative state. To be honest, this state is much more bad and harder than an actual coma or actual brain dead patient, because this vegetative state is prolonged. They can live like this for even more than 12 months. There will be very minimal recovery. People think that they will not hear anything, they will not listen anything, but the brain is functioning very minimally to a point that they can actually understand, and sometimes they may respond as well very minimally if the medical treatment and the care is given properly.
எதையுமே உணர முடியாது.
So I'm glad that he is doing the reflex by doing like this. Usually we have something called a knee hammer. We tap just below the knee. As soon as we tap below the knee will go up and down. So this is a brain reflex that comes from the brain into the knee. So the up and down movement of the knee, this is not happening voluntarily. It is happening involuntarily when you are striking at the exact same place with the knee hammer, and not like this. So another mistake. So patients like this will not have any reflexes at all, and that is what the point that they're trying to make, that even when you do with knee hammer, the reflexes will not be there.
உணர்ச்சிகள் செத்து போச்சு, ஆனா சப்ஜெக்ட் இன்னும் உயிரோட தான் இருக்கு.
Again, they're calling a subject and not a patient.
இப்போ கவனமா பாருங்க. நான் இந்த டார்ச் அடிக்கும்போது பியூப்பிள்ல மூவ்மெண்ட் இருக்கும்.
So this is called pupillary reflex. You know, when you throw a light on the eyes, the pupils actually respond, because remember I told you the brain is actually functioning very minimally, but there will not be any other, eyebrow closing activity, eyelid closing activity, or any other facial twitches, because that will require more power that this patient does not have.
ஆனா கண் இமைகள் மூடாது.
அதேரா போதும் போதும்.
See, he is asking to stop the light exposure, correct? Because that is where the empathy and compassion comes through. And I'm telling you, this is a very, very interesting topic. I wish more research are being done with it in terms of how empathy is actually converting a patient recovery.
சப்ஜெக்டால எதையுமே உணர முடியாது.
இது என்ன ஹிஸ்டரி ஜாகிரபி பாடம்பா? சப்ஜெக்ட்ன்றீங்க, அந்த ஆளு பேர் இல்லையா? பேர் என்ன? கீஞ்சது போங்க, பேரை இப்பதான் பாக்குறீங்களா? என்ன பேரு?
கேஸ் பேர் ஆனந்த்.
கேஸ்லாம் சொல்லாதீங்க, மிஸ்டர் ஆனந்த் மரியாதையா சொல்லுங்களேன். இப்ப என்ன கேட்டு போச்சு?
Correct. Wonderful point. Wonderful point. I'm glad that all this has been enacted in the movie. I'm so glad that the director has done a wonderful job.
புஸ்தகத்தை போச்சு இது தான் கடவுள் நினைச்சு நிற்பானுங்க. இதுங்கெல்லாம் நம்பாதீங்க. கடவுளே இல்லைன்றான் பாரு, அவனை நம்பலாம். கடவுள் இருக்குன்றான் பாரு, அவனை கூட நம்பலாம். ஆனா நான் தான் கடவுள்றான் பாரு, அவனை மட்டும் நம்பிடாத, போட்ட கேஸ் ஆயிடுவேன். உனக்கு எவனாவது டென்ஷன் கொடுத்தானா என்னன்னு சொல்லு.
This is a very, very important topic that they are just touching upon very casually. I'm going to tell you what I honestly feel, that allopathy is great. We have science-based, evidence-based medicine, science-based treatment options, so we can give whatever we want, where the outcome is most likely it's going to be favorable. But that is not the only treatment solution. We need to open our minds to other alternative treatment options as well. I understand that there is not that much amount of science-based evidence for alternative treatments. Maybe there was not enough funding, or maybe they didn't do research that much, but we cannot completely discard them. The ideal way to do, in my opinion, is for preventive purposes, we might have to rely upon non-allopathy treatment options where there is no harm to the body. At the same time, for treatment options, we have to combine allopathy treatment. So this is called integrated medicine. It is slowly booming up, but I strongly feel that in 4 to 5 years of time, this will be a mainstream treatment options where every patient should be given all the options available so they can make an informed decision.
ஆனந்தே ஆனந்தே, இவ்வளோ அழகான முகத்தை இவ்வளோ ரகசியமாக வச்சுருக்கிறேன். நர்ஸுங்கெல்லாம் பார்த்தாங்கன்னா இனிமேல் எங்களை சிஸ்டர்னு கூப்பிடாதீங்க, எங்கள் மனசெல்லாம் ஒஞ்சிடுன்னு போகிறாங்க. வாங்க வாக்கிங் போகலாம்.
There's another important point over here that I strongly feel that every doctor should actually do this. When I was in my medical school, there is a professor who tells to every patient, no matter how bad the disease is, the disease will get better. Be there, don't worry about it. If there is anything, our team will take care of you. He'll give us so much positive feeling that that patient, even though he doesn't get better, he will at least feel like, okay, so there is a hope and we are going to go in the right direction. And the other doctors will actually give them the reality sometimes, that this is the blunt truth. So there's a slight blending of information that needs to happen, and I strongly feel that this positive thinking will definitely help the patient.
உங்க வீட்ல இருந்து யாராவது வர முடியுமா?
This is a very important thing. We always say when we are delivering a bad news to the patient, we always make sure that the patient's family members are around so that they'll be able to handle the bad news in a better way, because support is very critical. So we will never deliver a bad news with the patient alone most of the times.
ஏன் என்னாச்சு?
நீங்க கொஞ்சம் முன்னாடியே வந்திருக்கணும். இனிமேதான் நீங்க தைரியமா இருக்கணும். உங்களுக்கு ஸ்டமக் கேன்சர்.
The method of delivering bad news is an art. It is not an easy task, and I learned it along the way because we see a lot of patients with cancer, like stomach cancer, pancreatic cancer, liver cancer, and the way that you deliver the bad news is entirely dependent on that particular patient's profile. It depends upon how they are going to accept the news based on what you know about them. Usually we make sure that we have a segue into it before telling them that you have stomach cancer. So the way that she delivered the bad news is not right.
உடனே அட்மிட் ஆயிடணும் நீங்க.
Usually you don't need admission for stomach cancer right away. That is a wrong mistake. And stomach cancer is getting very common these days. Stomach cancers are not that common in the Western population. When I practice in the US, I don't see stomach cancers at all. But if you move on to Korea, Japan, and even in India, the stomach cancers are extremely common. To a point, all the American experts will come to the Eastern world and learn about all the tips and techniques of managing stomach cancer patients in case if they have stomach cancer patient over there in the Western world. So the reason that it is happening in the Southeast Asia is because of this bacteria called H. pylori. It is very common. Not every patient who has H. pylori will develop stomach cancer, but some patients are at increased risk, and that's why when you have H. pylori, we will give you antibiotics to get rid of that H. pylori bacteria. Again, remember, smoking alcohol plays a major role in development of stomach cancer, and sometimes stomach cancer will not cause you any symptoms at all until it is very advanced. So from today, make sure that if you are smoking or drinking alcohol, please stop it. We don't want to have any kind of cancer diagnosis.
விடுங்க சார் விடுங்க இல்ல வீட்டுக்கு போய் அழணும் எல்லாரும் முன்னாடி அவமானம் ஆயிடும் சார் சொன்னா கேளுங்க சார் ப்ளீஸ்
சொன்ன சார் அல்ல உனக்கு 6 நாள் தான் குத்துக்கிறான்னு நினச்சிக்காத என்ன குத்துக்கிறான்னு நினச்சிக்கோ.
This is a normal phase of grief of any patient who has received the bad news. There are 5 stages of grief. Number 1 is phase of denial. They will be like, this cannot be true, this is wrong, please go and check the patient, this is not my biopsy report, so they will not be able to accept it. Second, they will have a phase of anger. They'll be like, why is this happening to me, this is not right, and they will shout at people around them. The third one is phase of bargaining, in the terms of, okay, so why is this happening to me? They will discuss with the higher power in terms of like what I can do to get me out of this. Number 4th is phase of sadness and depression. They will be like, why is this happening to me? I can't do anything, and this is going to be really bad for me. And the number 5 will be phase of acceptance. They'll come to a conclusion that, okay, this has happened to me, what can I do next? These phases that I'm talking about is not sequential. It could be like phase number 1, phase number 3, phase number 5. It can be mixed and matched, but this is the usual phase of grief. Many patients will be in the phase of denial for a long time, and that could be an issue that the doctors will have to handle. So our patient is getting better, he is able to move. So remember that this patient is not actually coma, because coma patients will not have any kind of reflexes that much. So in this patient is in a vegetative state. Remember we talked about it, they'll be able to listen, the brain can function very minimally. So now the patient is getting better because the brain has started to function slowly, but usually we will not see this much amount of recovery. So this is exaggerated. I think they are just bringing a point in the movies, but this will not happen in a very practical basis. They're making a point that Prakash Raj is very bad, so the patient is getting better, so we can make things better just with compassionate care. That is not true. Patients in vegetative state will not be able to do this much amount of reflexes. So for the masala, it's okay, but for practical purposes, this will not happen. That's all, guys. This is Vasul Raja MBBS review from me. I hope you learned some kind of medical angle to it. If you did, please write down in the comment section. I'd be more than happy to evaluate it. If you want me to review any other movies, please write down in the comment section. Until then, stay happy, stay gutsy. May God bless you.